Period pain should not be debilitating. Period. If someone tells you that your really bad cramps are normal, don't believe them. You could have endometriosis. Endometriosis happens when tissue similar to the lining of your uterus goes rogue and grows in places it doesn't belong, like on your ovaries, fallopian tubes, or intestine. And because so many people just live with the pain, it takes an average of 6 to 10 years for a person suffering from endometriosis to actually be diagnosed with the condition. That's a long time to wait for an explanation. Here are 5 warning signs or red flags that tell you something definitely not normal is going on. Number 1, intense period pain. Really bad cramps are a classic symptom of endometriosis. We're talking pain that makes you miss school or work, or pain that doesn't go away with birth control pills or anti-inflammatory medications like ibuprofen. Not all people with endometriosis have this much pain with their periods, and not all people with bad cramps have endometriosis. But really bad pain anytime is certainly something you should talk to your healthcare provider about. Number 2, chronic pelvic pain. If you have severe pain in your pelvis all the time, not just when you have your period, you may be experiencing the effects of inflammation and scarring caused by endometriosis that has been left untreated. The longer this cycle continues without treatment, the higher likelihood your pelvic floor muscles and nerves may also be negatively impacted. Number 3, painful sex. If having sex hurts, that could be a sign of endometriosis. Penetration can pull and stretch endometrial tissue that has grown behind the vagina or lower uterus. Endometriosis can also lead to pelvic floor spasm, which can worsen with vaginal penetration. Some people experience only a mild discomfort, while others experience a deeper, more intense ache during or after sex. Basically, if the pain outweighs the pleasure, something isn't right. Number 4, stomach problems. When endometriosis attaches to your bowel or causes kinking of your bowel from adhesions, it can wreak havoc with your digestive system, causing nausea, constipation, or diarrhea. It can also make you severely bloated, especially when that time of the month rolls around. Number 5, trouble getting pregnant. If you've been trying to get pregnant but aren't having any luck, endometriosis might be the culprit. And you're not alone. Up to 50% of women who experience infertility have endometriosis. Endometriosis causes inflammation and scarring in your pelvis. The scarring can also cause kinks in your fallopian tubes. This inflammation, scarring, and kinking make it much harder for the sperm and egg to meet up, or for an embryo to implant in your uterus. Endometriosis is a frustrating condition. Many people have symptoms, but some don't. Some people have mild pain. For others, the pain is unbearable. And for so many people, the road to diagnosis is an unnecessarily long one. If you're experiencing any red flags at all, it's important to see your healthcare provider right away. And remember, bad period pain isn't normal.